Nursing students, time to talk. Welcome to the Real Talk School of Nursing podcast. I am your good and faithful host, Michael Smith. Thanks for continuing to subscribe to the show. You can write in the show at realtalknursing@gmail.com or use Facebook Messenger or contact us through Instagram or Twitter to share your experiences, ask questions, and give feedback. Don't forget about Ben and Greg and the Shift Report podcast, and thank you to everyone for supporting our friends, affiliates, and sponsors. Thank you to everyone who started following us on Instagram, Twitter, and Facebook. More listeners means more and better shows. Make sure to share the episode with classmates and especially underclassmen and cohorts. Let's give a hand up to those who are coming behind us. We've got to build a community of fun, engaged, and supportive nursing students and nurses, so thank you very much. Don't forget to reach out and tell us if you have any announcements for graduations, good grades, difficult tests, friends you want to help congratulate, and your announcement will be featured on the show. If you like the show, the Real Talk School of Nursing podcast is available on iTunes, Google Play, iHeartRadio, Libsyn Web Player, Stitcher, YouTube, Spotify, and SoundCloud. So, go to wherever you download podcasts, subscribe, rate us, review us, write into the show, and smash that subscribe button. Remember to leave only 5-star reviews because that's the only ratings that count to get us noticed by more nursing students. Thanks for joining us for part 2 of the interview with Mark Klimek. With that, let's get the show rolling. Okay, so we're back. We're with Mark Klimek, and we were just talking about redemption at the end of hardship. But so let's take a step backwards real quick. I about 3 or 4 months ago, I reformatted the show to kind of being less of a single issue per episode into having 3 different segments. So I separated the show into prereq student issues, nursing school student issues, and then new grad NCLEX prep type issues. And then that way there's something for everybody at each stage, at each of the main 3 stages of their nursing school career, so to speak.
Right.
And one of the things that I continually say within the show is that there's more to nursing school than just content, and you hit on that a lot. I think, even though that you are doing a true content review, your live review is very content based.
Yes, it is.
But you still hit on a lot of stuff where it's like, okay, well, there's other factors involved and stuff like that. But can you talk about some of the challenges that you faced while you were going through school, that were life things, because everybody's got a story. Everybody's got something that went on during that made their education experience more difficult than normal, I guess. But can you talk about some of the challenges that you may have faced outside of nursing school?
Outside of nursing school that affected nursing school?
Right.
Yeah. I think the biggest thing for me was self-support, because I pretty much had to support myself. My parents weren't going to be doing that. And so it was me, and I had to run my life, live my life, support myself, as well as go to school. And I know that there were times, especially when I was going back to school for my baccalaureate degree, that a lot of times they were making me retake pediatrics, retake obstetrics, retake psych when I had already taken them. And I would get so frustrated with it because I thought, I already know this stuff. Why are you doing this to me? And so I kind of got a little bit of a bad attitude at times, and that was sad because I could have learned so much more. But I dropped a few classes just out of just feeling overworked, overwhelmed, and I needed to cut some slack in my life because I was burning too many candles, too many different directions. And I delayed a lot of classes, and it turned out that I had a huge number of credits still and only one semester to do it in. So my last semester at Virginia, I had to do 27 hours,
Jeez.
27 semester hours worth of work. And I just remember spring break, I couldn't go anywhere. I had to be in the library. And I just remember that this one time that I had done enough. I had just done enough. I couldn't do any more work. I couldn't think of anything interesting to say on paper. I couldn't study anything anymore. I was just saturated and done with this. And I think I got a little bit depressed, maybe a little anxious, maybe a little panicky, because there were 6 weeks to graduation, 27 hours. I still had a huge number of things to still do. And I just remember I had enough. And so I left school after I left the nursing school building the day, an hour after I took a test, which was the first test after spring break. So I took spring break off, studied, burned out, took a test. It didn't go well. And I walked out. I hopped in my car, and this is in Charlottesville, Virginia. And I hopped in my car, and I got on Route 29, and I just went south. And I drove, and I drove, and I drove, and I drove. And I just drove. And when I suddenly realized, oh, wait, you're driving. What's going on? I saw a sign that said, "Welcome to South Carolina." I'd driven all the way through Virginia, all the way through North Carolina, across the border of South Carolina in some sort of a trance-like daze, just because, my brain was done. I couldn't do anything. And I thought, okay, wow, how much money do I have in my pocket? I don't know. How am I going to get back? Where am I? I don't even know.
This is before credit cards, so you had to pay cash for gas.
You had to cash for gas, cash for everything. And I'm hundreds of miles away. And I really think that was it was sort of a wake-up call to me to tell me that, you're not, even though you think you have it all together, given the right set of circumstances, you can do some pretty bizarre things, and so you understand from now on, if you're going to teach nursing students, you got to understand that some of your students are only like one question away from driving to South Carolina, and so it's just that way, and so I think that gave me, it kind of gave me an empathy for the psychological warfare and trauma that happens in nursing school. It's not for the weak, that's for sure.
That's for sure.
But you don't have to be totally healthy either all the time. Do you see what I'm saying?
I do.
I made it through that.
I skid along at 20% for a lot of stuff. My audience knows, but you don't know. Like I started school at 35 years old. I'm a broke-bodied Army infantry officer, and I had 2-year-old twins at the time, and school was 90 minutes away, and they promoted the school as a nights and weekends, and it was certainly a lot of nights and weekends, but I think about 3 weeks in, they said, if you want to continue in this program, you have to quit your job.
Yeah.
And
exactly.
And so all of that stuff. But my gosh, I think most of my classmates, because there was only one person who actually was able to continue working. One person out of we started with, let's say 50. I think there was 48 or 49, but we started with 50 people. We graduated 44, but we also picked up 4 from the previous previous
classes,
cohorts, right?
Yeah.
And so I mean
It's tough.
I mean, and so out of all of those people, only one person could continue working all the way through.
It was tough.
And we were all, I mean, we all skidded along at that 20%. You don't have to be at 100% to make it through nursing school. And if you are, then you should be doing research, you know, I don't know, saving, like, I don't know what kind of research you should be doing.
Well, you need a life, is what I say. You know, there's more to life than nursing. You know what I mean? Nursing is a profession. It's wonderful, and you want to give the best quality care you can for a client. But when it's all said and done, their survival isn't 100% contingent upon you. Now, definitely, you can contribute to that or not contribute to that. But I mean, I think that you have to get realistic expectations for what you can expect yourself to do. And I think that's what my problem was there when I was trying to do 27 hours of semester work in my last semester and working to support myself.
Gosh, wow.
And it was just, at times you expect too much, and you just have to say to yourself, you know, it's okay to take another semester. It's okay to take another year. You know, it's all right. There's because nowadays, you talk to people that know me, they don't even have a clue how long it took me to get out of nursing school, how many years it took me. They don't know what I got on my pediatrics final. They don't know how high I scored on my state board exam. They don't know any of that.
So wait a minute, there's not like an asterisk next to your RN or something like that says, you know, you didn't make it through nursing school without having to repeat classes, or
right,
I heard if you fail the NCLEX once, you get a double asterisk after your name. Is that true?
Well, what is true is, at least, you know, what is true in at least Ohio. In this I don't mean to raise anxiety in your listeners, but in Ohio, if you attempt the exam and you don't pass it, and then you attempt it the next time and you pass it, your employer can look on there and see that you failed it once and took it again the second time.
Oh.
So I think that is absolutely unconscionable. I can't imagine that in this day and age that the state licensing agencies are allowed for the fact that you failed your boards to be public knowledge once you've passed them, that a previous failure is legal for them to know about. That to me is ridiculous.
Well, in some way, I mean, I understand what you're saying, but like, you know, as soon as, because I failed my first attempt. And it was because, just as a warning to everybody out there, if you're a new listener, because of the guests I have on here, and you're listening to Mark Klimek and you don't give a hoot what I say, but I got there because I got impatient, and that has always been my downfall. It has always been my downfall. I'm an extremely impatient person, and I got in there and I got through the tutorial, or I was trying to get through the tutorial stuff, and I wasn't expecting it, and I'm like, get me out of here. I've been here for 15 minutes and I haven't answered a question yet.
Exactly.
And that's what started it, and that got me down. But you know, afterwards, I mean, it shut off at 75 questions. I did so bad, it shut off at 75 questions, and I failed.
You dug yourself a hole.
Oh, I did. And but I got through that, and one of the hardest conversations that I had to have was not with my family, but with my boss, or my potential boss. I had to go back to them and be like, hey, we got to delay things a little bit. I was excited to start, and I know that you were excited for me to be there, but again, you can make it through, and it's okay, and that's perfectly, yeah. Fine. You take a scenic route.
No one will ever know. The best nurse I've ever worked with in my career, and I've been a nurse for 45 years. Best nurse I've ever worked with, failed her boards twice. I had no clue. She just told it to me one day, and I said, are you serious? You're the absolute most phenomenal, intelligent, brilliant nurse I've ever worked with, ever. And to this day, she still is the best nurse I've ever worked with. And she filled her voice twice. So, I mean,
But it's a different skill set. Like, I feel like I am a very good, well, I don't want to say very good. I am at the experience level I'm at, I am a good nurse. Solid within the band of good. Maybe not excellent. There's a couple other people who were hired about the same time as I would, and I would put one of them in the excellent category. I'm solid good.
Yeah.
But very, very reliable, very consistent, solid good. But, I just...
And that all works, there again, that has to do with the fact that, you aren't successful on your first attempt. Someday, that's going to make you a better manager of a person who comes into your unit, your place of employment, and they are not successful the first time. And you know how to work with them, and you know how to encourage them, and you know how not to give up on them, and how to, so that your experience can be used for good, even though it seems bad. So it's that same old idea.
I feel that way. I mean, I really do. I mean, as far as my life goes, that 6-week delay sucked. But as far as, but seriously, as far as the podcast goes, I go, I couldn't have asked for something better.
Exactly.
Because how many people continue, after they're done with the after you're done with the NCLEX, do people still go back and review, other NCLEX preparation resources?
Oh, they're on to something totally different. They've moved on.
Right, they've moved on, and I had this whole thing, and because I do the show, I do have this, motivation to continue talking about this stuff, but I can go back and I go, I've seen the test twice now, and I can say with absolute, not certitude, but I can say with pretty good, I don't know, something, but I can say with pretty good surety that, these questions from this service are really good. These questions,
right.
This service is, kind of good in this way, but, lacks in this way. And, this is this, and this is this, and this is this.
You've never had that perspective.
I never would have had that. And so here we are at the same point again where, redemption at the end of hardship happens. So nursing school is obviously very difficult. We all have, everybody's got stories about nursing school, about that when you're sweeping the bottom of the barrel, just trying to, you can't go any further down, so you're sweeping. So what's something that kept you motivated through nursing school?
Well, a positive and a negative. One of the things that I've always said to myself, because obviously I'm someone who thinks, I got to do this all myself. I'm just that type of a person.
Yeah.
I have a thing called that I crash through quitting points. That's sort of my idea. So
say that. Say that again.
I crash through quitting points. In nursing school, there are so many places where you'd be justified to say, I don't need this. This is bizarre. I don't need this amount of aggravation. This is ridiculous what they're, and you would be justified in quitting. But you got to crash through that. And what I mean by crash is it isn't pretty. It isn't smooth. There's collateral damage all over the place. But you crash through those quitting points. Everybody gets quitting points. Everywhere. And quitting points are often justified. But you can't give in to the quitting points. You have to crash through them. So I'll say to myself, when I get a tough situation, I'll say, crash through the quitting point, and you just bulldoze through that quitting point And you turn around and you go, oh, it's behind me. Okay, I've made it through. And you just, it's not that you're trying to excel at everything. You're just surviving.
Yeah, you just got to get through it.
Crashing through it.
Just got to get through it.
Yeah, it's just got to be that way. You crash through the quitting points. And I tell students that when they go to take their NCLEX, I say, you know, you're going to be on question 32 and you're going to be saying, what in the world is going on? Did I even go to nursing school? What are you guys talking about? Where are you getting this stuff? I've never heard of this stuff. Are you guys crazy? This is ridiculous. This isn't measuring anything that I know. It's not judged. It's not evaluating my ability to think. I don't know what you guys think you're measuring, but it certainly isn't nursing practice. So I'm out of here. And you'd be legitimate in saying that. But what you got to do is you got to crash through that question. You got to just crash through it and say, give me another one, you know, and then you hit another wall and you just crash through that and you keep on moving. And the people that get the license are the people that finish it. You know, you got to finish it. And because quitting can't be an option, you know, and you just got to crash through it. But that's when you look at it that way, that relieves you of the burden of having to do it perfectly or wonderfully or excellently. And I'm not saying the goal is mediocrity. I'm just saying the goal is realism, that anything that's difficult and worthwhile will have quitting points. And you just got to crash through them.
Yeah.
That's all you do. You got to just keep your head down and crash through it. And eventually you'll look up and go, oh, wow, okay, we made it through. And then wait for the next one because it's coming.
Patience. What is that? Who even has time for that? PIE is P-I-E. Patience in everything. It's a simple yet difficult, yet powerful thing to learn. Think about the last time you were impatient. What came of it? How patient am I with others? How patient am I with myself? How patient and kind am I with the trials and unexpected turns in life? Am I patient and fully aware of the blessings of each day? I've been given a gift, be it fruit or life. It's up to me to choose how to use it. This is a book of short essays on life through something as simple as pie. Here's Coletta reading Piology 101.
Piology 101, the synchronicity of pie and life. How awesome to ponder how our Creator has put our individual ingredients so carefully together. Yet we get to choose our finishing touches and the temperature settings of the day. Sometimes we're hot, sometimes we're not. Every day is spent forming our own creation of self. Some days we also form a pie. Our ingredients of the day can be mixed up, nutty and complicated, or just sweetly simple. Fruits grown out of even the best soil and conditions may become bruised, but even imperfect fruit can become a pie to savor. Life, as imperfect as it may be, has a multitude of savory and sweet bites in each new day. Pie and life, filled to the brim with the fillings of our choice, oozing and bubbling over, and just so beautifully messy. Pie and life, any pie or day can end in failure and be perfected on the next. Pie and life, presented in pieces and are just what is left over, or sometimes well presented, well-rounded as a whole. Pie and life are made up of a beautiful variety of spices and different tastes. Pie and life, overworking can make it too tough. Pie and life, tender care will always produce a perfect foundation. Pie and life, dig in while it's fresh. Share that creation.
Get your copy of The Pie Letters by Coletta Hewitt in softcover or ebook from thepieletters.com. That's thepieletters.com, and buy your copy in softcover or ebook from thepieletters.com, or you can go to Amazon. Love you all. God bless.
You're listening to the Real Talk School of Nursing podcast.
again, I've talked about my nursing education experience on the show a lot, and just, there was so many times where like instructors would just say, one in particular seemed particularly focused on making sure that I never made it into the nursing profession. And I was just like, you can tell me, you can ask me to leave. I will never ever quit. Like, you will never, there is not enough pressure in the world that you can apply to me that is going to make me give up.
Right.
There's just not. Because I have been through in my life. I mean, one advantage of being an older student going through school is that I've got some hardship behind me, and I go, I'm sorry, you think that you're putting pressure on me right now, and you are, and I feel it, but you are nothing compared to having my twins at 6 weeks old both crying, at the same time. and one has explosive diarrhea, and the other one throws up all the milk I had, and there's, I'm sorry, you don't compare. Go away. I got this. It's like, you can ask me to leave, but I'm never going to quit, and that is such an important lesson. And I think going through nursing school, you do have those instructors that want to teach that lesson. But again, because and maybe you're right. Maybe it's because they're really good clinicians. They don't understand the educational strategy in order to say, well, I want to test someone. I want to make sure that they're, that they've got all the tools they need in order to withstand the pressure. That doesn't mean you have to make life completely miserable for them.
Exactly.
On purpose.
Exactly.
On purpose.
Right.
Because the material will do that. I mean, the material is hard enough that it will test people. Right. And test their ability to make it through hardship and through adversity and all that kind of stuff without you making it difficult on purpose, which is also something the military excels at.
Yeah.
So can we, one last question, and then we'll take a break. So how has nursing education changed from, and you can answer it from the perspective of an instructor, but if you can take the perspective of a student, so how has nursing education changed in the last 20 some odd years that you've been teaching?
Okay, when I started teaching, one of the biggest things that was happening was the professional anxiety about being the handmaiden of the physician. And so there was a lot of professional insecurity in the nursing profession. We wanted to be a science. We wanted to be at the table with the big people. You know what I mean? We wanted to eat at the big people table. And we didn't want to be just a nurse. And there was a lot of professionalism, anxiety. And there was a lot of emphasis on nursing diagnosis, nursing process, DRGs, trying to get our own diagnoses for which we would be compensated as professionals.
Sure.
And so early on in the 80s, there was a lot of pressure on nursing students to do an awful lot of paperwork related to diagnosis, differential diagnosis, defining characteristics,
sure,
implementing NANDA, NIC, and NOC. I don't know if you remember any of that.
Oh yeah.
Heard of any of that?
Oh yeah.
But we used to focus on all of these enormous care plans, and I remember students would turn into me 38-page care plans.
Oh, 38 pages sounds wonderful to me.
Yeah.
No. Seriously. I had a friend who went through. She was an RN and then went through her RN BSN, and I think I'm in my third or fourth semester of school, and she had just finished. I'm like, hey, can you send me some of your care plans? Maybe I can discern some wisdom from this stuff, and she sent me this crappy cell phone picture, and she goes, and I was like, that's a really cool cover page. And she's like, no, that's the whole thing. And I go, oh my God, you have a 1-page care plan. Mine were the shortest one that I had, I think it was either 21 or 20. I think it was like 27 pages.
Exactly.
27 single-spaced pages. And at the same time, I had a classmate who had a 60-page care plan.
And these were due every week with almost every patient that you had.
Yep.
And they had to be theory-based. You had to pick a theorist like Oram or Roy or Leininger or Watson, and you had to do all of the care with all the terminology and perspective. You had to phrase it and formulate it in that lens of that theorist. And there was a big emphasis on nursing theory.
Sure.
And nursing, and you had to have research, whatnot. So it was a lot of theoretical in the classroom, while when you would go to the hospital in the clinical settings, it was very hands-on and very workmanlike, because nurses were still, I remember as a nursing student in my first years of teaching students, I would teach them how to do morning care and bedtime HS care.
Yep.
You get your little cart, you put on the juice, you put the lotion, you get the towels, and you go around to all the rooms and you give everybody a foot rub, a back rub, an orange juice, and tuck them in and say goodnight, and it was all very, very workmanlike in the clinical, but it was very theoretical part in the classroom, and there was such a disconnect that it was really difficult to teach students how the two worlds connected. Mm-hmm. So you almost lived in nursing education as a teacher. I felt like, okay, I'm teaching this in class, but that isn't what the world's like there.
Well, and we had like nursing theory. I mean, that was one of the very first units that we had in my program. And I was just like, you guys are building skyscrapers and you haven't even cleared the ground yet. Half the I had been an ED tech for a year at that point, I think, and I'm looking at my classmates going, half of these people don't know how to take a blood pressure, and we're going through Madeline Leininger's theory on. I was like, how could we possibly be here? And I totally feel that disconnect. I totally felt that disconnect. Papers.
One assignment would be writing, how does Martha Rogers's theory, how is it a healthcare mirror of Einstein's theory of relativity? How does that play out? And then you go to clinical, and I remember I had a student who took an IV tubing, the two ends of the IV tubing. One was the spike end, and the other was the hub end that went into the catheter. Right. And she was trying to put the spike end into the catheter and the hub end into the bag, totally upside down, so the drip chamber was like an inch away from the insertion point of the IV. It was all totally upside down. She didn't even know which end of the IV tubing goes into the bag and which end goes into the patient. It's.
But she was probably great at nursing theory stuff.
Yeah, she could tell. She probably got an A on the Einstein-Rogers theory. But there was that dichotomy that was problematic, and that's actually also what was happening in practice. There was a big dichotomy between the PhD poobahs that were running nursing nationally in all the organizations, and then the frontline nurses and the nursing boards that were in a different place. And there was a lot of rivalry and some competition between those two groups for what nursing education was all about. And I remember them saying, you can teach a monkey to IV push medication, but how do they know what the assumptions are, theoretical assumptions are of their practice? And I thought, well, theoretical assumptions never killed anybody, but if you IV push it wrong, they might not do so well. So it's really hard it's a hard thing. There was a big disconnect. And I've seen now more of a reasonability about, yes, you do have to understand what theory does for us. And you have to understand what evidence-based practice does for us. But we're preparing you for a generalist, novice practice.
Because half the stuff you're going to learn on the job anyway.
Exactly.
I mean, and that's that was certainly true as an EMT. That's been true of almost anything that I had to do, where you're learning something in an education setting and then going out in the real world and doing. There's tons of OJT that's got to happen. There's just there's tons of that, and partially now because you have nursing school, you're learning how to be a novice generalist.
Exactly.
And and people are going to go. Some people might get a job in a cardiac, or a CVICU. Somebody might be in a cardiac or a neuro step down. Somebody might just be in a regular good old fashioned med surg unit. I'm in the ER. I know, there's so many things out there, and there's so many skills that, there are skills that people in the ICU have that I'll never touch.
Right.
Mm-hmm. And there are stuff that I do in the ER that a med surg, and actually that's happened. One of the med surg nurses came down and they're like, "Oh my God, it's so crazy down here. How do you deal with this?" And you were like, "It's not even busy right now. What are you talking about?" But it's a completely different.
We're playing.
We're playing
cards at the desk.
You're right. We're playing cards.
One of the other big changes in nursing education I've seen, and it sort of parallels the change in acute care in hospital settings. Back when I first taught nursing students back home, because I've been a nursing faculty member teaching students for 39 years.
Wow.
So 30 years ago, we could do anything skill-wise. We had access to do any and all skills we wanted to do.
Uh-huh.
So I could go into clinical and I could start IVs and I could give IV push meds. We didn't give that many IV push meds back then. But I could give injections. I could do suctioning, put down NG tubes, catheters. You could do skills. Any skills you wanted to do, you could do.
Mm-hmm.
But that was back in a day when the hospitalized client was not nearly as acutely ill and unstable as they are now. I remember assigning students, two patients. A student would have two patients today. One of them was a cholecystectomy, and it was day 7. Day 7.
In the hospital?
Day 7. Post-op cholecystectomy in the hospital. Because their stitches weren't removed yet. And they couldn't leave the hospital with stitches in. And stitches were removed back then on day 7. We didn't glue things like we do now.
Sure.
But there's stitches. So you would have another, and the other patient they had was a sigmoidoscopy for possible cancer, and he was admitted the day before, had his sigmoidoscopy the morning of the second day, and this was the day after, and we were still housing a sigmoidoscopy the day after the procedure without any complications at all. Well, if that's the level of acuity, then an instructor can feel free to allow students, the hospital feels free to allow students a lot of leeway and independence and autonomy and initiative in doing skills. Because there really isn't much you can do to a 7-day post-chole that's going to mess up their life. It isn't going to happen. But now that the acuity is so unstable, so high level acuity, people that were in the ICUs back when I first started teaching are not even hospitalized. They're taken care of at home. and people that were in the ER were sent home or whatever. So now what happens is you've got these students, these novices out there who are practicing on your license as a faculty member in situations that are dynamic, unstable, complex situations with very, very sick people who wouldn't even be still alive back 30 years ago. We had no means to, we didn't have ECMO and all of these things.
We are, the medical profession is a victim of their own expertise.
Exactly. And so what happens is now, as a faculty member, I can't give a student the autonomy, the freedom, the independence to go out there and just work with these patients. They have to be supervised and guided, and they have to have nurses following them around because they can actually, these people are so fragile, you can't give a novice the experience. So here are novices trying to learn novices skills so they can get confidence and the good basic care down in units where there aren't any novice appropriate patients.
Right.
And so what they end up doing is hospitals say, students can't do this, they can't do that. They can't do this till they're in their senior year. They can't do that until they've had a pharmacology course. They can't do this until they have that. And so as a faculty member, you have to provide, what I'm seeing is students are getting experiences in hospitals that are more observational and less performance than they ever used to get. And they're actually getting less hours of it. So they're getting less clinical in a more quasi-observational status. Whereas back when I first started teaching nursing, I could assign a student to a patient and they could pretty much do everything for that patient, much like what they do in their precepted experiences. But you can't allow, and hospitals are now starting super users. Are you doing that in your area, super users?
Yeah, so we have super users for, mental health. We have super users for sepsis. We have super users for, just about anything. I mean, anything specific.
In our areas, they're getting to be super users for starting IVs, super users for doing NG insertions, super users for doing glucometer, capillary blood glucose checks, such that since students aren't super users,
they can't do it.
And since their faculty aren't super users, they can't do it.
Okay, so we're not that bad yet.
They can't do these. Yeah, they can't do these skills. But what's funny is if you look at the local hospitals saying what do they want our students to be able to do when they graduate, it's start an IV, insert an NG tube, work in an arterial line, calibrate a wedge pressure, on a Swan-Ganz and all this kind of stuff. But then they won't let them actually do it in the hospital. So I don't know how. So that's a problem that we need to wrestle with in nursing education, is how do we get students confident and proficient to a novice practice level when the acuity of the patient and the requirements of the hospital are not providing us with the clinical experiences we need for our students.
Because
that's probably the biggest thing.
And that's a big problem. There is I really do feel like, and that's a project that I have going off to the side that I haven't talked about with anybody yet, but that's a project that I have going off to the side is that how do we, how can I, just as a regular old staff nurse, in a level 1 trauma center, ER, how do I close the gap between nursing education, or what can I do to help close the gap between, whether it's an ADN, a BSN, or an MSN initial entry nursing program, before they get into a clinical setting, and how do I close that gap?
Right.
Because there is a huge gap. It feels like there's tons of, even pathophysiology stuff where it's just like, and partially because you have these, it's not a nursing school, and it feels like a lot of the tests that you have are single variable questions.
Yes.
You know, you're saying if this person is hyperkalemic, you know, what are the things that you're going to see? Like, okay, well, that's fine, but you're not just going to see a person.
Not acidosis situation.
Right. There's going to be 10 other things that are going on with that. So you may not even see any of those symptoms because of what else is going on with them.
Correct.
So
I think the biggest thing is we see that there are gaps. And I think back in the day, the gap was between nursing education and what they felt the important educational objectives were, and practice, what they were actually doing. There was a big gap. Now there's a gap between what the healthcare system expects a new grad to do,
right,
but what they'll actually allow a new grad, a nursing student, to do in clinical. And so there, I think whenever you engage in an endeavor, there's always going to be a gap. And I think we're just sort of, and everything is cyclical, and you end up with gaps. And so I think that's what I'm seeing, is the new gap is now not a difference between nursing education and nursing practice, but between hospital-based expectations and student experience opportunities. That's the biggest thing. So I hear students always complaining, all I do in clinical is sit around, and I know that someday I'm going to have to do all of this. Why can't we learn this now?
Right.
You know, and they want to be engaged in clinical. They want to be active in clinical, but they're just sitting around because they're not allowed to any initiative or independence. Yeah. And I understand it.
I was most of us, we had to have, if we had a patient who had been in the hospital for 6 weeks, which was normal in some of the units that we were on. You know, you had to have, you know, what was their sodium level all the way back to the very beginning, and then you had to chart it in there. Well, what does it mean on what day, and where's it trending? And it's like, oh my gosh. So just to write all that stuff down, because you can't copy and paste, you know, to write all that stuff down takes hours.
It does. Yes.
And I mean, thank God we didn't have 4 patients at a time. Are you tired of the same old badge reel? Do you have to wear the same scrub color as everyone else? Are your undershirts boring and kinda stinky after wearing your lucky shirt through 5 in a row 12s? You can wear your personality in other ways. Go to badgeladybynerdwear.com and check out her massive selection. Tell her you're a Real Talk School of Nursing podcast listener and use the promo code REALTALK20 at checkout for 20% off your order. Expect 2 to 3 weeks for custom orders, and a few days depending on her actual job schedule, because she's a real nurse, to get your badges made and shipped. I know you'll treat her like your best friend at clinicals, so go to badgeladybynerdwear.com and order the coolest custom and original badge reels out there. Go to badgeladybynerdwear.com and use the promo code REALTALK20 for 20% off your order. That's badgeladybynerdwear.com. and use the promo code REALTALK20 for 20% off your order. Thanks for listening to Part 2 of the Real Talk School of Nursing Podcast, Episode 70, with guest Mark Klimek. Like the post and follow us on Facebook, Instagram, and Twitter to see when Part 3 is posted. Subscribe, rate us, review us, and write into the show. Smash that subscribe button. Don't forget to join me for Part 3. This Real Talk School of Nursing Podcast is a Real Talk production. This podcast is dedicated in loving memory of my brother, First Lieutenant Justin Smith, Blood and Steel.
Sic semper tyrannis, facta non verba.
Good night, Steve Cannon. Wherever you are. Annyeong kasayo. Now you go home.
The
If you like the show, the Real Talk School of Nursing podcast is available on iTunes, Google Play, iHeartRadio, Libsyn Web Player, Stitcher, YouTube, Spotify, and SoundCloud. So, go wherever you download podcasts, subscribe, rate us, review us, write into the show, and smash that subscribe button. Remember, only leave 5-star reviews. That's the only rating that counts to get us noticed by more nursing students. Write into the show at realtalknursing@gmail.com or on Facebook Messenger. You can also join us on Facebook, Twitter, and Instagram. We're building a community of fun, supportive nursing students, and I want you to be part of this crazy nursing school journey.
School of Nursing podcast is a holy moly, I can't believe you're still listening to this podcast.